Welcome to a National Hispanic and Latino Mental Health Technology Transfer Center's webinar. This is our school-based mental health program for Hispanic and Latino children and youth. The Hispanic and Latino Mental Health Technology Transfer Center is one of 13 centers recently established by the Substance Abuse and Mental Health Services Administration, or SAMHSA, to build capacity and provide technical assistance to better serve those in need of high-quality mental health services. It is also one of the only two national-level technology transfer centers, or TTCs, serving specific populations, in our case, school-based mental health service providers of Hispanics and Latinos. The purpose of the MHTTC network is technology transfer, disseminating and implementing evidence-based practices for the treatment and recovery of mental health disorders into the field. If you need any more information or we can be of assistance, feel free to contact us. The school-based mental health program works specifically with schools, organizations, and professionals to strengthen their capacity for providing cultural and linguistically responsive mental health information and services to Hispanic and Latino children, youth, and their families through training, technical assistance, and capacity building assistance. Scott Bloom has spent his career at the intersection of mental health and schools, working to improve access to social-emotional services and resources by integrating these programs into school systems, creating opportunities for students to overcome emotional and behavioral barriers to academic achievement. He is the founding director of School Mental Health Services for the Office of School Health in the New York City Department of Education. The School Mental Health Unit facilitates partnerships with mental health organizations, implements mayoral tribe NYC projects, and focuses on prevention initiatives that have created a citywide system of mental health services and resources in over 1,800 New York City schools. He has been working with children and families for over 28 years. He serves on the advisory boards for a number of cities, states, and national mental health initiatives, including the Center for the Advancement of School Mental Health at the University of Maryland. Mr. Bloom has contributed to journals, magazine articles, book chapters, and has presented a local and national conference on school mental health. He is also certified as a psychotherapist and a private practice and supervision in New York City.
And welcome, everybody. I'm very excited and appreciate this opportunity on behalf of the National Hispanic and Latino Mental Health Technical Transfer Center at the Universidad Central del Caribe to present to you today School as Client, Mental Health Services for Diverse Populations and the School Culture. I want to first go over the agenda, welcoming everybody today. Talk about our learning objectives, excuse me, move into a new paradigm of school mental health to give you a background and a frame today's webinar. Then we'll be going right into School as Client, and that's really where the nuts and bolts and sort of the meat of this presentation is all about. And then we'll wrap up with a number of resources and ways of communicating and working with teachers here. I want to emphasize that this is not a clinical webinar, but working with school administration is like working with a client or a patient. In other words, you do need to use your clinical skills in working with the school administration, with teachers, and the whole school community as well. So when you're collaborating with school staff, and how you collaborate and how you think about it is really what this webinar is all about here today. So at some points, I'm going to be interchanging the words school social worker or clinician or provider. I want to make sure that anytime I use any of those phrases, that you know that I'm really talking about the same thing. Some of you may be working for your Department of Education. Some of you may be working for an outside social service agency. Some of you may be an intern at a university, and you're known as different things: social workers, clinicians, providers. So there will be that interchangeable aspect in today's presentation. It's a good thing, as Carlos said, this is going to be taped and it'll be available in a week because I have a lot of information to cover here. I'm going to try to move at a clipped space and here so that I can get all the information in. So if there are questions, we'll have some opportunities later on, and there'll be ways in which you can contact us to follow up. So just so we're all on the same page here, our learning objectives today is to identify key historical contexts that frame school mental health, right? We want to help you recognize areas of tension and conflict between the multiple stakeholders in your school. As Carlos said, I have 28 years of experience, most of that working in schools. I started out as a school social worker. I've been on both sides of the table, so to speak, as a provider, as a social worker, and now overseeing our New York City system. So I think I have a lot to offer. We also want to identify contexts at work in which collaboration across the integration of various systems and mental health supports for both students and educators. I'm going to be talking about best practices, and I'm not going to give it in sort of one shot, like, oh, at the end of the webinar, I'm going to go through 5 slides. I'm going to pepper them throughout the webinar, so this way you can take note of connecting some of those best practices, some of those tips, so to speak, when we talk about certain concepts. And finally, at the end of this, the idea here is really to create a toolbox of strategies, things that you might have used before, things you never heard of before. And I hope you're able, in whatever setting you're in, to share this with some of your colleagues as we move on here. Okay. Trends in education. It's important to understand, you know, when I get out of a meeting, I'm sure at the end of this webinar, I'm going to have at least 30 emails. But if I'm a principal in a school, I'm probably going to have about 100 emails on average, maybe even more. So mental health and school support services may not always be a high list of their priority. So it's important to get an idea of what are they looking at? Put yourself in their shoes, so to speak. And let's put on the principal's cap for a moment here, right? So the first thing is about the education reform movement. Right? I imagine you're all aware right now that there are a lot of trends in education. The last administration had the No Child Left Behind, and experts tell us that that's here to stay, right? So what can the school social worker do to incorporate this new way of looking at academic services? When we think about performance, the culture in education has changed from one to entitlement to performance. Many educators across the country now are doing performance-based. They're opening schools, closing schools, rating schools, and you know in your districts how that takes place and that added pressure. Accountability. We're all accountability, just like you and I are accountable to our jobs and our tasks and standards. Everyone in the school system, including the school social work program, is now held accountable for student results, right? We're typically looking at those results, which are major players tend to be attendance and academic achievement and graduation, right? We all know school districts and schools are undergoing these state reviews and city reviews because of previous lack of accountability. All things data. All things keeping records, how many, the reach we do, the implementation we do, and what are those outcomes. Certainly the high stakes testing, this is an emotionally charged and highly contested issue in some states, especially where tests determine diplomas. So we now have this standards-based movement. And lots more students are getting test anxiety. I get calls from principal all the time about test anxiety, Regents anxiety, IB diplomas, and parents now are taking a stance and actually pulling students out of these tests throughout the various grade levels. So it's a very interesting kind of issue that has arisen in the last few years. Certainly one that's very important to our clinical programs is the achievement gap, particularly with equity and access, right? We want to ensure that there's equity and access for all students. particularly students and minority students, those maybe in the lower income. We see in some states and some cities that the rates of students in special education or suspensions tend to be students of color. That's where the percentage tends to get higher here. So there's that kind of disproportionality of youth of color and minorities who get into suspension or have discipline, and the research is out there. So we as clinicians need to be aware of that in the schools we work in. A lot more emphasis on school safety, certainly with mass shootings and the tragedies that befall our schools that meet their national levels. But you and I know that on a daily basis, there's always a crisis situation that's coming on board. And maybe sometime in the future, I'll do a webinar on the crisis situations and how we handle those. So many schools have metal detectors or scanners, and sometimes students don't want them. They feel marginalized by it, but often the parents say, no, I want to protect my child. So school safety is becoming a very important issue. And then finally, charter schools. And I'm not here to say that charter schools are good, bad, or indifferent. The reality is that charter schools often end up in public school buildings. That means that taxpayers paying for public schools are also paying in some essence for the charter schools. And there's often lottos involved in that, and how do you get in? And that also could be an issue that folks are dealing with. So in essence of all of that, what I want you to take away from this is, while many of our students struggle to meet new academic standards, we know that there are other contributing factors, such as emotional difficulties and lack of school readiness, right, that interfere with the student's success. So academic success is never negatively affected by related chronic conditions such as mental health problems, right? So if you take that all together, and here's what I'm saying, is that these set of factors creates a condition for the school social worker to adopt a new paradigm. I want you to consider this, that a shift from actively saying, oh, we're a support service, to really becoming part of the academic services. You are an academic service. Now, how to balance that new shift and juggle the new mandates while providing quality mental health service is really the core of this presentation. And as we'll move on right now. So there are many positive outcomes by having school social work and mental health services in schools, right? Part of it is to reduce the number of students referred to special education. And if you think about the label that happens, kids are given the label serious emotional disturbance, or SED. And you can imagine if you were a parent that your child is labeled seriously emotionally disturbed. That sounds very serious. So we try to reduce, by offering our services, reduce the numbers of kids who come into special ed, trying to decrease the number of kids being sent to the emergency rooms for non-emergency. That's why the kinds of interventions we do are preventive, and they help to act early. A lot of studies indicate that those in counseling or treatment do better in improving their grades and academic achievement. We know we can help teachers and empower them to manage their classrooms more effectively. And we see a lot of research now that has to do with school connectedness, or maybe you've heard of it as school climate. So typically at the end of the year, the parents and students will take surveys regarding what's the school climate like. Is there a school connectedness? So here's one of the first tips to do. This comes from my friends at the Center for School Climate. What they do at the beginning, in sort of the middle of every year, or after the first 3 months of the school year, the principal gets all the teachers and all the staff involved in a room. They have the names of all the students in enrollment up on a bulletin board, and everybody's given a dot or a post-it. And everybody is supposed to put a dot or a post-it towards the name of the kid that they know, they recognize, they say hello to. And then when the exercise is done, there's always a handful or maybe more of kids' names on the postcards, and there's no dot, there's no post-it. And the principal says to them, these are the kids we need to give attention to. Doesn't cost anything to do. It's a win-win situation for students because by bringing attention to those kids that nobody knows, you might prevent kids from falling through the cracks. Again, a quick win for school climate. So let's look at also some of the numbers. You know, I know that I may be preaching to the choir out there, but it's also important to take a look at some of the numbers of students, what we see across the country in terms of emotional disturbance. Here you see some diagnoses. This is back in 2016, where you have Hispanic youth in the orange color columns and non-Hispanics in the blue columns. And here's just gives you an overview in terms of our Hispanic and Latino population. You see there's a higher rates of adjustment disorder, higher rates of anxiety disorder, not as much ADHD. Conduct disorder is a bit higher, not as much bipolar disorder, but certainly depressive disorder. And there are numerous reasons that unfortunately we can't go in today, but it's something that the Technical Transfer Center will address later on and through the year. If we take a look at our YRBS, if those of you are not familiar, the YRBS, as the title says, that means the Youth Risk Behavior Survey. It comes out every other year, odd years, and that comes from the CDC, Center for Disease Control in Atlanta. And every year, every other year, high schools across the country, high school students are given a survey that may have somewhere between 110, 120 questions. And I know in New York City, we always look at those 4 or 5 that have to do with mental health. And so you can see here a comparison between white non-Latinos and Latinos in terms of feeling sad or hopeless in the last, more than a number of times in the past 12 months. I think it's 2 weeks or so, which links to the definition of depression. And so as you see here, you have 31% versus 33%, where the males are about almost equal. We see certainly female Latinos higher rates of sad or hopelessness. And we move to suicide, it's a little more for the Latino males, and certainly 3% or more for the Latino females. And again, this is something that the center can talk more about. I know in New York City, it's pretty similar, although we see for the sad attempted suicide, we see the Latino females, again, about 3% more than the non-Latino females for both men and women. And in terms of sadness, we see a 6% difference with more with the Latino females than the non-Latinos. So it's to say that none of this should be acceptable. There's no perfect rate here, right? It just means that we need to do more and need to press in more into schools. So why mental health in schools? So I'm going to go through just a few slides here. This one looks at schools are on the front line of the communities, right? It's the logical point of entry. Why? Because this is where the kids are. This is where they spend most of their time growing up, is in school, 6 hours a day or more. This is the first time that their problems arise, right? Because all of us, we grow up in our families, in our homes, and we have our typical culture, our norms, our family backgrounds, the way our family communicates. And then one day you go to PS 101 or the Abraham Lincoln School, and you're 5 years old, and all of a sudden you've got to go to the school's culture. And that culture is going to be different. Why? Because every school has their own norms, their own values, their own ways of communicating, their own ways of showing affection and praise, and certainly their own ways of discipline. So it's important to know that what often happens in a school is that teachers see things for the first time, whether it's abuse, neglect, sadness, a withdrawal, absentee rates. That's why schools get involved, because they're seeing things that maybe for one reason or another, we don't know what could be normative in that family. So it's a logical point of entry and frontline identification, right? The idea here is that we as social workers, we know how to identify kids who may have situations, how to approach them, and how to refer them. And this is often what we try to get teachers to do. It's a more natural setting for students because this is, again, where students are. By having services on site, it closes treatment gaps, wait lists, a lack of services in the community, particularly for students of colors and minorities. And then certainly important role in public health campaigns. And in some instances, you might be the only mental health clinician or person that student and family sees for the duration of their school years, for all 18 years, because of lack of services. So it's pretty important to the sort of role that you play here. How it affects student achievement, right? Because there are fewer disruptions due to behavioral challenges, fewer disciplinary actions taken when mental health is involved. I know we see high teacher and staff turnover rates. We know that mental health services research shows that it improves academic achievement, including some of those standard test scores. And if we have mental health services and you are there and you're helping the teachers, you're working with them, we'll go into that in one moment, it increases teacher confidence around mental health issues. The bottom line is we're not here to make teachers therapists, but we can raise their skill level. We can, as my mission is in New York City schools, is to build capacity so schools can address mental health issues. And I would imagine that that's part of one of your missions is to build the capacity. And these are the things that we do. Resiliency, it's one of the hot topics right now, right? We talk about trauma, we talk about resiliency, and we know that students benefit from having more mental health because it does increase resiliency, right? I'm not going to go into all of that, but we know resilient students mean that they can adapt to situations, they can adjust to situations. That's what we want to see our youth do. Improvements in schools to decrease, decision making, school culture, social emotional skills, positive interactions with others. If you take that list of bullets, we're talking about executive functioning, right? We're talking about how students cope with skills. And by increasing the resilience, the research shows that it does. And just you're working with them. Alice Miller talked about the silent witness, that each student, each child needs to have somebody who appreciates them. And sometimes for multiple reasons, it can't be the mother or the father, but there needs to be somebody in the school. When you look at dropout rates in surveys to students why they dropped out of school, the number one reason was nobody took an interest in them. And that's a very sad thing in a school. I don't care if it's 200 kids or 2,000 kids. Nobody took an interest in them. And we often are that silent witness, as Miller talks about. We are often that person who helps them and connects them. As I would say to my clinical staff, all roads lead to Rome. It's all about relationship building. And so we're going to be moving towards, in a moment or two, is your relationship building with the caregivers. And those caregivers happen to be teachers. So in summary, for this first part, and this is a fundamental concept here that I'd like you to know, is that school goals equal mental health goals. Learning and mental health are securely intertwined. School goals are mental health goals, and mental health goals are school goals. And that's part of our job, is to promote that. The second thing is, given the amount of need and lack of unlimited services, we need to start focusing on improving natural context in which children learn is critical, right? That goes again about the school climate. This is the context of learning here is in the schools. And mental health has to be, we're not an outpatient, we're not a hospital, we're not a community center, we're not a mobile crisis unit, we work in the school. So you have to know what that means by working in the school. And finally, effective, feasible ways to support students in the classroom. There can be that collaboration between the community and school mental health resources, things like anti-stigma programs, social emotional learning curriculums. There's a number of ways of doing it. So let's do this quickly. Perhaps in the chat box, I want you to see if some of you can answer this question for me. Give me one type of intervention or program that you think overcomes barriers to academics. Doesn't have to be mental health. It could be other programs. What programs would you put in a school that could help overcome barriers to academic achievement? So if you can type some answers, so just quick thoughts. It could be one word, a few words. Maybe it's a lunch program or a nutrition program, or it's good busing. If folks want to type into the chat box, I'd be happy to take a look at some of those. And if not, if you don't have that ability, if you're just listening, then just think about what one or two of those are. Okay, I'm not seeing anything in the chat, but that's okay. So just keep that or write it down for yourself. So now I'm going to, if we look at this slide, I love this slide. The reason why I love it is because if you look at the various interventions, which one wouldn't you have there, right? Social services, pregnancy prevention, violence and crime prevention, pupil services, phys ed, drug services, right? All of these are barriers to academic achievement, and they would all help. But how do you put them all together, right? How do you organize them? When I do a school visit, I call the principal and I say to them, I'm going to meet with you about a service that your school is getting. I'd like you to have at that meeting who you consider your school support team. I go to schools and sometimes it's just me and the principal. Sometimes it's 2 other people. Sometimes it's 15 or 20. Why? Because you have all these community-based organizations, these CBOs, and each of them have a mission, and each of the schools have a mission. So they start competing against each other. So one of the things, and this is another tip that I say, one of the things we can do is help to organize that. Have a kids cabinet or a school wellness council, so that at least once a month or once every other month, all these competing programs meet together to give updates, to cross-refer, to make sure that, again, no student is falling through the cracks, right? Again, I don't think any of us on the call would disagree with these, but we want to make sure that those are all organized. So there are 2 things that are very clear in the research, and even clearer to teachers and social workers and principal. The first is about children's learning, right? Their ability to read and write and do math and science. It matters for their emotional and social health, their relationships with peers, and their own sense of self, right? So children who are far behind in reading or math often disengage. They may start acting out in the classrooms or withdraw. So on the left side, you see achievement, right? The test scores, the grades, the productivity, the time and task. On the right side, we also have another lens, right? You ever go get your eyes examined? They cover one eye, then you have to read the chart, and then they cover the other eye and you have to read the chart. Well, what we're trying to do is on the left side, we've got the academic. On the right side, we have the mental health, right? The second achievement is for children's mental health. Their social, emotional, behavioral adjustment matters for their learning. Right? This means that children who are struggling with anxiety or kids who are impulsive often have a hard time with their academic work. Going back to the executive functioning. What we want to do is put these 2 together, right? We want to show success in school, right? So the arrows go both ways. As I said in the previous slide, mental health goals are academic goals, and academic goals are mental health goals, right? Schools, for whether we like it or not, they do 2 things for students. One is they help them to think. They help them to critically think. That's what schools should be doing. And the second things schools do, whether we like it or not, is that they socialize youth. They socialize no matter where you go. Socialization is the second outcome of being in schools. Why? Because students learn about relationships, they work out problems, they have conflicts that they emerge. Why do you think they do math? Math is all about relationships, logical thought, critical thinking. Science, it's all about hypotheses and situations. So when they want to ask somebody out on a date, they're like, she's in gym on third period. If I go by the gym on third period and I drop my pencil and I bump into her accidentally, then maybe we get to say hi. Or, oh, I noticed she has lunch seventh period. If I go to the lunchroom on seventh period, that's going to be great too. So those are the types of things that science and math, it's not just about learning, but it's also about relationships in schools. All right. So the first thing we want to do here is we want a realignment of support staff, their roles and functions, right? We have student supports. And as we have student supports, we also know that learning supports are important here. So we want to, again, reframe student supports as learning supports that address barriers to academic achievement and realign support staff roles and functions to develop comprehensive, multifaceted, and cohesive approaches to schools, right? If you call up a parent and you say to them, oh, Jimmy is disrupting class again, he's throwing chairs around, he's spitballing, he won't get out of the coat closet, he threw his lunch into pieces, the parent on the other end is going to say, so what else is new? Tell me something I don't know. That's for you to handle. But if you go to have that same call, but do it differently, reframe it, right? As we say in family therapy, we reframe it. Hi, Mrs. Jones, this is Mr. Bloom, the social worker. Uh-oh, what's going on? I just want to let you know that we're finding out that Jimmy's having a hard time concentrating in math. Oh, tell me more. Yeah, he's just not comprehending what's happening. He seems to be distracted a little bit. I wonder if you could come in and we can talk about problem solve some of this. Do you think that's possible? So which one would be the one that you would want to go to? The first call from the school or the second call, right? Student supports are learning supports and learning supports are student supports. So now we move into our second piece here. The school is client, right? Just like we know as clinicians, we work with clients, we work with patients. And if you look in front of us, you in front of the screen, you'd probably say, oh yeah, right? I do a presenting problem. When a client comes across my office, we do an assessment on that client. We do a treatment plan, and then we follow up with treatment, right? Because we want to know the client's strengths, their weaknesses, their coping abilities, their emotional range, right? We want to know how they define the problem. So the same could be said for the schools we work in. So this is a concept that I've developed many, many years ago. And again, I do a lot of presentations on just this and go into depth. We have to look at the school as a client. This is where your clinical skills come in. And the first thing we do is look at a presenting problem, right? Like any client you initially meet, each school has its own reason why the person is receiving the services. So it's always important, usually at the beginning of the year, or at the end of the year, to get an idea, or maybe it's a new school that you're assigned to. I don't know how your agencies or how your schools deal with that. We want to know what they think, why were you asked to the meeting? Was it an urgent need? Was it about mental health issues? How do each of the stakeholders view the problem? Sometimes we get presenting problems, handed to us in a form or record or referral. Right? The presenting problems why you receive the services. So it's always important to, again, what social workers do really well is put yourself in their shoes, right? Why do you think you were asked to meet them? Why are they considering support services? So whether it's you're just meeting with the principal, or you're meeting with those 15 CBOs or guidance counselors, SAPIS workers, social workers, behavioral specialists, you name it, right? We run the gamut. You want to begin to do a sort of mapping of those services, what they have, what they don't have, what they think they need, what they truly need, right? What they want and what they need, just like we know with our clients, are two different things. And that takes us to an assessment, right? And all of us do different kinds of assessments when we meet with clients, right? We do all kinds of different stress assessments. The way that I prefer and I would recommend is this three-tiered model. This is a public health approach. So it's the bottom right, it says universal interventions. The middle group is selective interventions. And the top is targeted interventions, right? So we want to do an assessment. And assessments, sometimes they can be electronic. Sometimes we look at, it could be a questionnaire. We look at potential strengths and barriers to improve their quality, access to services. So we look at staffing. We look at what's worked, what hasn't worked. What do they see as their priorities? What are those issues that they haven't been able to solve? What are those stakeholders that are not at the table? So as best as you can, you want to be able to meet with all those stakeholders I talked about earlier. Principal, often the deans or the assistant principals know more about what's going on than anyone else. Teachers, social workers, nurses, it could be. You want to be as inclusive as possible to do an assessment up and down this three-tiered model. We want to walk through them a few times so you can check in. I want to make sure I understood it. I want to get back to you. I want to make a report so we're all on the same page here. And what that does is sometimes people just see this as an assessment. I see this as your first intervention. The fact that you're meeting with all these school stakeholders, you're curious and interested in what they're doing, you want to make sure that they're getting all this information is an intervention within itself. And so let me talk a little bit about this three-tiered model, so to speak. On the left-hand side, you see sort of what the school social worker does. On the right-hand side, here's the students and the various problems and the various interventions. So those universal interventions, those are on the bottom, right? I'll go back to this slide. Those universal interventions, right? Those universal interventions, about 80% of all students, those are those interventions that seek to promote positive mental health and educational success. So it's parent workshops, teacher trainings, anti-bullying programs, a school-wide positive behavior in schools, those PBIS programs. Secondary prevention or selective interventions is you want to prevent kids from being at risk from more serious problems. And this is typically group work, anger management classes, coaching, restorative practices, coping skills, right? The idea is you want to prevent students from moving up the triangle. And finally, students with intense mental health behavioral problems, targeted interventions. This is where your DSM-5, your treatment, your counseling, your family counseling, collateral sessions, and individual sessions come up. Again, here's just a slide that shows you how those interventions might look on the left-hand side from the social worker's point of view, and on the right-hand side, what intervention you might have from a student's point of view. The next phase after the presenting problem, the assessment, is the treatment plan. And here is what are the ways that you become integrated into the school, right? We know that a treatment plan is a plan of action done by trial and error, always checking in. You want to make sure that schools have certain vision in mind. Now, this can be a long process. It could be 3 to 6 months with a new school until they understand your role and you understand the culture of the school. Particularly if you're working from an outside agency, you want to get integrated so that if a parent walks into the school, they don't know that you work for a hospital or community center. They just think you work for the school. That's what you want. I always get principals tell to me, Scott, it's a win-win for the school and the families when we have these services. And I say, how come? It's a win-win because the kids are getting the services they need and parents begin to trust the school. We'll talk about that in a moment. There's something that I call stairwell therapy. When I used to hire school therapists, I don't hire wallflowers, because you're going to get eaten alive in a school, right? You all know that. You can't just sit in your office waiting for people to come. You have to be out there. So it's okay. It's a little different in terms of giving high five to students. When you see them in the hallway, saying hello, stopping, asking how they're doing. How was the test yesterday? Sometimes they need to talk to you for 10 minutes. So you find a place under a stairwell, in a hallway somewhere, where you can check in with them. It's different than a traditional community center or patient therapist setting. It's a little more open. Doesn't mean that you're letting go of confidentiality, but you want to make sure that you're doing that, right? Because we work in a school. You become a constant object in their lives. That's what I was talking about before, the school connectedness. You want to have quick opportunities to check in with them, right? And this is also part of sort of the nuts and bolts that happen on a daily basis. I want to quickly review the stages of relationship development. Bruce Tuckman provides some of this material. It's a quick way of learning it: form, storm, norm, perform. We form relationships. We make our needs known. We work towards a win-win. That's a storm situation. Why? Because sometimes it takes, 3 months or so, again, for them to know exactly what you do and what the school culture, right? You're hashing out how to work together, referral pathways, bringing you into the classrooms. You're two people, in essence, that are brand new, the school and you. So you're meeting for the first time. So there could be territorial issues, suspicion, what's in it for me? Oh, what do you add to us? There's a lots of sort of trying out. So in essence, these stages of development are part of your treatment plan, right? The form is coming together. Here's our agreements. Here's our assessment. The storm could last, again, it could last 3 weeks. It could last 3 months. Then you start moving into the normative phase, right? These are the daily tasks, the follow-up, the thank you notes, the I'll get back to you, the I don't worry, I'll handle it, the consistency, the reliability, the ownership that you own what you do in the schools. And this is typically after 3 months or so, you get to know everyone's name, they get to know you, right? So just like from the clinical aspect, those of you who may be familiar with the concept of the good enough mother, this is out of Donald Winnicott's, that the good enough mother, he says, from the infant to the mother, the good enough mother is reliable, is consistent, is caring, provides safety and predictability. The good enough mother is that constant object. And just like the good enough mother that meets the needs of the infant, that's what the school social worker needs to become. You need to be predictable, reliable, and consistent, not just in the students' lives, but in the teacher's life. And that's part of the normative. And finally, there's the performing. That's when you talk about your accountability, performance versus entitlement. You publicize the successes. You say, hey, I prevented a bunch of students from going into special ed, in the last few days because I took them on instead of going into special ed. And how do we do that? Well, we use language, and language is the key to development of working in any relationship. So we have to learn the language, and this isn't something you're going to find in the textbooks. Again, this is something that I developed many years ago. With any client or patient that comes into our office, we need to learn their language. Each client that comes through my door is like a lexicon. It's like a dictionary of signs and symbols that has to be unlocked, right? So this point is, I want to emphasize, often there's confusion and misunderstanding of the role that the social worker plays in the daily school fabric. Parents are apprehensive, students might be mistrustful, school staff may be puzzled at what our function is. So I'll give you an example. I've done lots of school visits, and in 1,800 schools around the city, one of the first things to do, I play this game. How do I learn the language of the school? I go into the principal's office, and that office is going to tell me a lot. I go into an office where it's pristine, All the awards are on shelves. All the certificates are on shelves. It looks like, oh, this principal's not a principal. It's like a CEO of a Fortune 500 company. That means I better make sure my tie is on right, my jacket, very courteous, and how are you? Well, here's what we're here to do. It's almost like a business planning meeting. And then I go into more offices, principals' offices. The phones are ringing off the hook. There's stacks of paper all over the place. There's flyers flying down. People are going in and out. The principal says, "Excuse me," every 2 minutes. So what do I have to do there? I have to say, you know what? I only have 5 minutes. No problem that you're in a hurry. I have 5 minutes, and here's my 5-minute pitch. Right? It's like I have to have an elevator pitch. And then there are some schools, I'll give you, for instance, I came into one school, there was wall-to-wall paneling. The principal had Grateful Dead posters and rock band posters and Bob Dylan and the Yellow Submarine. I said, oh, this guy is stuck in the 60s. And sure enough, when he came in, he had no tie on. Hey, Scott, how you doing? He was sort of hanging loose, so I kind of hang loose with him. I met him. I met where he was. And he really appreciated the services. That tells you something about the culture. That tells you something about where is this school like, right? That tells you how to approach the school. So it's important when working with any member of the school community, by learning their language, it's a step into an empathetic approach. It's part of that reframe that I mentioned earlier. By learning the language, you can start building trust with folks. But before we go on, I want to take a moment here, being mindful of the hosts who are hosting this webinar, is that learning the language that also deals with the culture. And I'm not going to go into this in a great depth, but I want to make sure that people have sort of 4 or 5 thoughts when they're working with the Hispanic or Latino population. This comes from the Natural Resource Center for Hispanic Mental Health, and I know that the Transfer Center is going to be doing a lot more work and going to be doing trainings and things like that in the course of the year. Certainly respect is key when engaging with Hispanic families, right? Just because a person is Hispanic or how they identify themselves, they may not know the mainstream language well enough, or for all that matter, they may be uninsured, they may be illegal immigrants, and that's a large issue I'm not going to tackle here today. But we know many Hispanic families are afraid right now to sign anything, to even show up to school, because they think ICE is going to show up. And I imagine that you're all dealing with that. I know we're certainly dealing with that. We just have to remember Hispanics are still human beings. It doesn't matter, right? And they deserve to be treated as you and I would like to be treated, as if your loved one was in need of mental health care. And I think this is something that you can help get across the school staff, right? Don't assume that you know everything about that person. Oh, they're Latino, they're Hispanic, I know everything there, right? We also know that Hispanics come from nearly 20 different countries, and they share some characteristics the same, but some of it is very different, right? So we need to find out, be curious. It may have nothing to do with mental health, but this is what we call engagement. Oh, what country are you from? And what are some of the cultures? Oh, interesting. And almost as if you're a tourist, right, to the country. What's going on there? And do some background search. How is Nicaragua different from Puerto Rico? How's it different from Costa Rica? How's it different from Spain? How's it different from Mexico? How's it, right? It doesn't hurt. It gives you more information, so your expansion of letting that family in becomes more full, right? And there are many assessments like SDQ and parent instructions that it's important, screenings I was mentioning, to have in different languages, because we want to demystify that for our parents, right? We know the Hispanics come from diverse countries, and so it may not be formal or strong mental health care system, right? Or maybe that mental health care system has a disproportionality in representing racial or ethnic groups. Again, mental health often carries a stigma, whether you come from Wisconsin or you come from Guadalajara. It doesn't matter, but it's important to find out, right? How does that family see the school? Some families drop the kids off and they say that's school business, that's it. Other families want those strong connections. So it's important to make sure that we understand that, right? The other thing I know we do in many communities in New York City is develop relationships with Hispanic community leaders, particularly the religious leaders, leaders who deal in Espiritismo, and other natural Hispanic and Latino members of the community. It's a way, they understand often the needs for mental health, so it's another way of helping to bridge that gap in the schools. And finally, when it says you don't misinterpret shyness or quietness for depression, every culture displays behaviors differently. So just because, for instance, a Hispanic woman may look down, she sits quietly, you may, wow, I think she's depressed, or her poor eye contact or flat affect may actually be culturally acceptable, right? So let's not go in with any assumptions. Let's go in there with an open mind and some background, because it helps. It helps because we want to, that parent, right? We want to gain that trust just like we want to gain the trust in the school. So there are the different kinds of trust. There's communication trust, contractual trust, and competency trust. Right? Contract, you stick to the agreements and to the boundaries. Communication, your word is good. You've learned the language of the school, right? Competency, your actions speak louder than words. You want to develop these different types of trust with all the school community. And if you think again from a clinical point of view, think about trust versus mistrust as part of our Erik Erikson and the developmental stages, right? That's the basic foundation of the infant to the world and to the parent. We have to acquire that sense of basic trust. And this includes tolerating the unknown, giving up, taking with, being dissatisfied. This is the same thing with our teachers, right? They don't know who we are, what we're about. So we want to make sure that we're consistent. And time again, for instance, many times I was in a clinic once in a school and a teacher ran down because another teacher had an epileptic fit. What do I know about epileptic fits, right? But they said, oh, Scott, you have to come, you and your staff. So we went into the class and we got some information off the internet. And what we were able to do was, help them, calm them down, and help the kids understand and demystify what happened. And then she came to us afterwards and said, oh, now I know what you do. And so what's happening is that we can able to be flexible and be strategic in that. One of the key concepts that I want folks to know is about school time versus real time. Just want to take a pause here. I understand we are going over. There was a lot of information here, so I'm going to be skipping through some of these concepts. I appreciate those who are staying. It looks like most of you are. I appreciate that. You will get the other information that we don't get to. So I think this is a real important, because this is the feedback I get, so I'm going to let you know. There's real time versus school time. In all my years of experience, I've come to accept that there's real time, and right now the real time is on this clock, right? It's 3:53 p.m. But school time means it doesn't matter. School time means that there's an emergency right now. It's 3 o'clock. It's last week. It was 2 minutes ago. School time means what's happening in that moment, right? There's always some kind of emergency, some kind of crisis. In most schools, it's mostly drama, right? But there is real time and there's school time. We have to understand that each is different, right? Because you can have a meeting and you say, oh, I'm going to meet with all the school staff, 9 o'clock, and you go there and nobody shows up. Why? It was an emergency. Or, oh, it was a snow day and you weren't notified. Or, oh, we forgot to let you know that we were having a lockdown today. Sorry, you can't come in the building. This happens all the time. We have to understand that each school is different, illogical, and most schools operate in ways that don't make sense to you, right? So they're juggling, as this slide shows, all different things. So I tell you, you need to be flexible. Don't take it personally. Just like a client who has to manage multiple tasks or a large family with many needs, that's what a school has, right? So you have to deal with your own countertransference, right? And think about how the school staff might feel. In some ways, you're joining a system, and we have to offer that school unconditional positive regard. So now I'm moving into my last piece. Again, I'm not going to be able to go through all of them. This is an area where various conflicts emerge. I'm not going to be able to go into this in great length, but you'll be able to review that. In terms of effective ways of communicating to teachers, what if we do if a teacher is unaware of a problem, right? What do we do with a client? We move from a more macro to a more micro. We move to more gradual focus on specific problems. Teachers often get defensive. They take it personally, just like you would use, a kid or a client. You want to be as empathetic as you can, particularly to be aware of your own defensiveness. You want to be aware of your defensiveness. So you might say, hey, you know what? It sounds like the problem has made it challenging for you to accomplish your goals with the student. I'd be happy to help you figure it out if you're comfortable with that. Make it appealing. Make it offer yourself, so to speak here, right? Often we take things personally. So do teachers. They take it personally, right? So make suggestions rather than be criticism, right? We want to acknowledge, wow, that must be really difficult. But how can you and I, work collaboratively? Let me know how I might be able to help. Oh, you're right. I tend to be a little more professionally. Let's just sit down and talk about this. Or, you know what, Mrs. Jones, to the teacher, I may not be explaining myself clearly, so let's meet. Often we can feel devalued, right? Because we can take on the projections of the teacher. We can take on their feelings, and then we feel, oh, I'm not good enough. I'm not worthy enough, right? We take on that devaluing. You want to take the pressure off the student. You want to become that neutral person. And if you can take it off and accept the projections, you're right. I'm sorry for taking them out of class every day. Let's talk about how we can do it. It takes the onus off the student and puts it on you. And I say it costs nothing to do that, right? Change is never easy. Again, we want to make quick communications. It can shut teachers down. So teachers need to feel appreciated. And there are different ways to capitalize on teachers' positive behavior, capitalize on their wins. Teachers need to feel that other school personnel support them, recognize their assets, work with them on challenges, and do things like Teacher Appreciation Day, be flexible in meeting with them. It goes a long way. There's a lot of chaos that goes on in schools. I don't need to tell you all of that. Often social workers are brought in to be disciplinarians, make sure that you stand your ground and stay in your lane, because schools now offer lots of alternatives to discipline. You're not there to fix the kid, right? But there are all the alternatives like restorative practices, peer mediation. Learn those and put them into the schools. This is just about, I'm not going to go into this depth, all the different stakeholders and sometimes the struggles that happen with that. Let's look at this, just a few more slides, almost done. Be respectful, be professional, be prepared, be reliable. Again, that constant object. You want to be the good enough mother for that school. You want to get help early. You want to, again, make the connections, how those mental health gains or academic gains. Teachers have informal networks, and so do principals. So if you're working in multiple schools, they're going to say, oh, yeah, Scott, he's a really good social worker. He helped me out with this and that, right? So you want to be respectful. Here's a lot of things that you can do here. Teacher feedback is invaluable. Introduce them to screening tools. Don't just throw them in the mailbox or send them to the parents. Talk to them. Here's what it measures. Here's how it's helpful. Here's why it's going to be helpful. So that kid is going to learn more, right? Explain that it's obviously difficult to meet every day with teachers. Let's find time. offer teacher opportunity to get feedback from the results. Sometimes because of confidentiality, you can't say a lot, but if you can say to them, hey, Johnny is doing really well, or get a consent form from the parent so that they allow you to talk to the teacher. Most parents will do that, right? Sometimes we do bulletin boards, brown bag lunches, welcome packet to teachers when they come on board. You want to paper their mailboxes. Sometimes we stick chocolates and tape them on to things we want them to see. Newsletters, electronic communications with Twitter, Facebook, school websites, special display. We live in a world where every month there's, National Pride Month, National LGBTQ Month, National Social Worker Month. May is National Child Mental Health Month. Every month you could do another kind of event, or you can brown bag. What I mean by that, you can say a topic, how to make a referral to my office. So for one day in a week, you could bring in some sodas or some snacks into all the teachers' lounge, and you can offer them services, right? Finally, there's the community out there, and I don't have time to go into that in a big way, but there's a community out there. So you want to do a community walk. What are those resources in the community near the school? From transportation to social services to other kind of entitlements. Find out what's nearby so that you can bring those folks in to be guest speakers, connect the families, connect the students to meet with them. And that's really important to connect to the community. So I know I've gone over time. Most of you are still on. I appreciate that. I just want to acknowledge all the folks who have contributed to my knowledge and today. If anyone wants any questions, I'm going to hand it back to Carlos and take it there. So I just want to again say thank you for listening. Carlos, are you there?
Yes, I'm here, Scott. Thank you so much. Well, I'm going to go over some questions here. One person asks, how can we make everyone in school aware of their role in supporting the students' mental health?
Right. So that goes under what I call promotion. And promotion is not just about, posters or flyers or we're having a health event. It's really about promotion is also in communication. So I think that you might form one of those, a number of things. One is, if there's a student council, get them to be one of your allies. Find those gatekeepers and other allies in the school that really see the benefit of what you do and meet with them. Again, however you have to entice them, with some food or something like that they can maybe stay after school, or there's a free period, and sit with them and go over sort of those roles, those functions. One of the first things I do when I meet with a new school, I said, here's what I can help you with, and here's what I can't. I can't do the lunchroom, I can't do the hallways, but here's what I can help you, and if you work with me, we're going to see some really good outcomes. So I would create, could be an ad hoc committee, a student wellness count. A lot of times mental health, people see that as a stigma in itself. So I would start with there. I would get involved in school orientations. I would make sure you have one or two be part of a wellness fair. You want to go to the PTA, the family coordinator when they have report card night or any Saturday event, or the school is open late. You want to be part and parcel. That goes about being the fabric. So those are just some tips that work.
Okay, Scott, so another question would be, which are the major behavioral difficulties observed in New York with Hispanic and Latino students?
I think what we see high rates, certainly in the Latina, the adolescent females, is suicide ideation. And we certainly have, I think, experts in the mental health transfer, the technical assistant transfer center that may be able to offer some information and send out to you. But we see that a lot of it has to do with acculturation issues. A lot of it has to do with parent-child issues. How girls are seen, how boys are seen. So that's part of it. That's comes from a lot of the work that our Dr. Zayas does with the Transfer Center, one of the advisors. And so what we do is we want to do a number of things. There are a lot of suicide prevention, right? What we want every teacher to do, just like they're mandated reporters for abuse and neglect, we want to make them mandated observers for suicide ideation or psychological stress. We want to help them to identify what does that look like. So we do trainings on with youth mental health first aid, at-risk types of avatar trainings, making education partners. There's a number of these evidence-based trainings. We also do make sure that they can they feel comfortable approaching a student, and then making sure where on that school campus they can get help. So I would say suicide ideation, and then certainly anxiety that has to do with adjustment. And many of our we do newly arrived immigrant groups to address that, because often newly arrived immigrants, they feel marginalized. So even just, a group work is great, particularly with teens, is to get them to know each other and say, hey, I have that problem, so do you. Oh, I was sent here from my grandmother. Oh, my parents are still in Mexico. I haven't seen them yet. Oh, right? So it helps with behaviors. It helps with, again, assimilating to, while keeping their identity and their traditions. We do a lot of parent groups for particularly Latino parents. And so here's a beautiful thing. Here's another tip I didn't get to. So you have the parent coordinators, and what do? Once a week, all the parents come and they do flower arrangements, cooking, things of that nature. And they said, oh, by the way, oh, look, who just walked by? Scott Bloom. Oh, come in. He's a school social worker. Oh, Scott, would you mind talking about how to help parents deal with their kids and test anxiety? Look what we just did, right? They were coming to do flower arrangements or sewing or, being advocates. And, oh, who just happened to drop by, right? We know that was planned, but it works because it's starting to normalize and make typical. Mental health should just be like you go to the nurse, you go to your social worker. So that was a little long way, but I hope to give you some insight into that.
That was great, Scott. I just want to go back to that question that you asked about what type of interventions or programs that would overcome barriers to academics. For some reason, the chat wasn't available to the whole audience, but people did suggest different things, and I just want to read them. They mentioned stress management classes, small peer support groups, good behavior game, speech therapy, teacher availability, after-school programs, emotional intelligence, small peer group support. So that was some of the same things that people mentioned.
Right, and everyone got 100 on that test. Everybody got an A because they all work. The point I was making you want to make sure you leverage that together. Right, because you go to a principal and they'll ask for everything and anything you can give them.